have respiratory problems, are there additional measures that you should be taking? Now, we know that this virus is more severe in certain groups of people, and people with respiratory problems is one group, but really any underlying condition that places you at more risk of severe disease would also be a concern, and this could include heart disease. We don't have clear information on HIV infection or tuberculosis, but we know that those infections place you at risk of other respiratory illnesses, so those groups would also potentially be in the high-risk group. And also elderly people, people over the age of 60 and even more so over the age of 70 are at more risk of severe disease. So if you are in one of those groups, then you will know that you need to take extra special measures to prevent infection. So it's really just practicing the measures that we do recommend, frequent hand washing. If you are in one of those risk groups, you really need to take special care not to be in contact with anybody who's sick, and to remember to stay at least 1 meter away from anybody who could be potentially infectious, because the virus spreads in those droplets that we release that can travel for 1 meter. If you're in a risk group, you should think carefully about going to large gatherings where you could be mixing with people that you perhaps don't know if they're sick or not, and you should try really to limit contacts with people, because we know that the spread of the virus is through contact with other people. If there are settings where people with risk conditions do congregate, for example, old age homes or care homes, and those areas need to also be taking special precautions at this time to start thinking about the ways that they can limit the introduction of the virus and limit people from the outside coming into those communities. So absolutely, we do need to be focusing on the people at highest risk of severe disease, and really making sure that they take extra special care to implement all of the recommendations.
If you develop symptoms of respiratory illness, including a cough, fever, and shortness of breath, you must seek medical care early. It's important to call your doctor first, self-isolate, and advise on your travel and contact history. If you would like to know more on anything relating to COVID-19, call the General Public Hotline at the National Institute of Communicable Diseases on 0800 029 999, as well as 0800 111 132, or log on to www.nicd.ac.za.